Hi everyone, I am Karina Pico, a nursing student from Visayas State University. Today I am going to discuss about tetanus. Let us first define what is tetanus. Tetanus, also known as lockjaw, is a bacterial infection caused by Clostridium tetani that affects the nervous system. It leads to painful muscle contractions, particularly to your jaw and neck muscles, and can interfere your ability to breathe and threaten your life. Tetanus cases are rare, but it remains a threat in those who aren't up to date with their vaccinations. Predisposing factors include failure to get vaccinated or to keep up to date with booster shots against tetanus, an injury that lets tetanus spores into the wound, and a foreign body such as a nail or splinter. Predisposing factors include puncture wounds, including from splinters, body piercings, tattoos, and injection drugs. And also gunshot wounds, compound fractures, burns, surgical wounds, injection drugs, animal or insect bites, infected foot ulcers, dental infections, infected umbilical stumps in newborns born of inadequate vaccinated mothers. Once tetanus toxin has bonded to your nerve endings, it is impossible to remove. Complete recovery from a tetanus infection requires new nerve endings to grow, which can take up to several months. Complications of tetanus infections may include broken bones. The severity of spasms may cause the spine and the other bones to break, and blockage of a lung artery or pulmonary embolism. Usually a blood clot that has traveled from elsewhere in your body can block the main artery of the lung or one of its branches, or worse, death. Severe tetanus-induced muscle spasm can interfere with or stop your breathing. Respiratory failure is the most common cause of death. Lack of oxygen may also induce cardiac arrest and death. Pneumonia is another cause of death. And let's move on to the pathophysiology of the tetanus. A bacteria in an adverse environmental conditions evolves to survive. Bacteria forms bacterial spores to survive and develop into Clostridium tetani. Let's first define what is bacterial spores. Bacterial spores are highly resistant dormant structures formed the bacterial spores are formed in response to adverse environmental conditions. They help in the survival of the organisms during adverse environmental conditions, and they do not have a role in reproduction. After a bacteria develops into Clostridium tetani enters deep flesh through wound. Clostridium tetani is an anaerobic bacteria that actually develops in environments that do not contain oxygen. When Clostridium tetani enters deep flesh through wound, Clostridium tetani grows inside the body and the production of powerful toxin called tetanuspasmin begins. And then, yes, production of tetanuspasmin. And then, tetanuspasmin impairs the motor neurons what you call, yes, the motor neurons or the nerves that control the muscles. And the two major symptoms of of tetanus are muscle stiffness and spasm. Other signs and symptoms include difficulty in swallowing, stiffness of abdominal muscles, painful body spasm lasting for several minutes, typically triggered by minor occurrences such as a draft, loud noise, physical touch, or light. Possible other signs and symptoms may include fever or convulsion, sweating, elevated blood pressure, and rapid heart rate. In diagnosis of tetanus, doctors diagnose tetanus based on physical exam or physical assessment, medical and immunization history, and the signs and symptoms of muscle spasms, stiffness, and pain. Laboratory tests generally aren't helpful for diagnosing tetanus. There's no cure for tetanus, and the treatment focuses on managing complications until the effects of tetanus toxin resolve. It usually involves medications and supportive care. Medical management includes care in the hospital, immediate treatment with medicine called human tetanus immunoglobulin or TIG, aggressive wound care, drugs to control muscle spasm, antibiotic, and tetanus vaccine or vaccination. Pharmacologic management. Your doctor may give you a tetanus antitoxin, such as tetanus immunoglobulin. However, the antitoxin can neutralize only if toxin that hasn't yet bonded to nerve tissue. But if the toxin already bonded to the nerve tissue, antitoxin cannot be used anymore. I mean, it doesn't have any effect anymore. Your doctor may give you antibiotics either orally or by injection to fight tetanus bacteria. All people with tetanus should receive the tetanus vaccine as soon as they're diagnosed with the condition. And sedatives. Yes, doctors generally use powerful sedatives to control muscle spasm. And other drugs such as magnesium sulfate, certain beta blockers might be used to regulate involuntary muscle activity such as your heartbeat and breathing. Morphine might be used for this purpose as well as sedation. Other supportive therapies. Severe tetanus infection often requires a long stay in an intensive care setting. Since sedatives can inhibit breathing, you might temporarily need a ventilator. Preventive measures include good wound care. Cleaning the wound is essential preventing growth of tetanus spores. This involves removing dirt, foreign objects, and dead tissues from the wound. Also, tetanus vaccines or tetanus shots are recommended throughout your life. The four most common vaccines of tetanus are DT, DTaP, TD, and Tdap vaccines. And tetanus vaccine is this is the guide on, like when you should be vaccinated. Tetanus vaccine is given at 2, 4, and 6 months of age, with boosting doses at 4 years, between 15 to 17 years, and at 50 years of age. Adults who haven't had a booster in the last 10 years should get one when they turn 50. Individuals who received a primary course of 3 doses as adults should receive booster doses 10 and 20 years after the primary course. Adults who have sustained tetanus prone should disinfect the wound and seek medical attention and receive a boosting dose of tetanus vaccine if more than 5 years have elapsed since their last dose. And if there is a doubt about prior vaccination history, tetanus toxoid should be given. Nursing diagnosis includes impaired gas exchange, risk for injury, and hyperthermia related to infectious process. Nursing management includes maintenance of the airway, prevention of the complication of respiratory dysfunction such as atelectasis. I've mentioned earlier that the most common cause of death in tetanus is the respiratory failure, so the nurse must take note of that. Treatment of autonomic nervous system dysfunction such as cardiac dysrhythmias, maintenance of proper gastrointestinal function, maintenance of skin integrity, and compliance with prescribed immunization schedule. I've also mentioned earlier that one of the other possible signs and symptoms of tetanus is fever or convulsion. If the client experiences seizure, the nurse should monitor the position of the head and eyes during a seizure, use loose clothing, accompany or stay with the client during seizure, maintain airway clearance, that's the most important. Give oxygenation, monitor neurological status, monitor vital signs, record the length and characteristics of seizure and take note of the posture, motor activity, and possession seizure. Manage medication anticonvulsants. And also environmental management includes identification of the client's security needs, keep harmful objects away from the client, install the side rails to keep the client from falling, provide a dedicated space, limit environmental stimulation such as sound, touch, and light, limit visitors, and encourage the family to wait or be close to the client. That's all for today. I hope you have learned from me. Thank you. Bye.